abdominal pain. All right? This is kind of like right before your boards. Actually, school started in Memphis Friday, and we're already getting the phone calls. I got this kid. He's had belly pain, terrible belly pain for about a week or so. School's starting. All right? So, let's talk about some associations with this. All right, you get a history, you got belly pain, you had trauma. What do you think? You think perforation, hemorrhage, some sort of musculoskeletal injury, or pancreatitis. Again, bilious emesis, intussusception, volvulus, an incarcerated hernia, adhesions. Of course, you had to have a surgical history to have adhesions. Peritonitis, you think, appendicitis, cholecystitis, or PID. An adolescent female, obviously you think PID, pregnancy, ectopic pregnancy, ovulatory pain. A current jelly stool should be a big, huge flag to think it's intussusception. And melena, if you have a stool that's melanotic, that means it's been pretty well digested and you start to think upper GI bleed of some sort. Well, how do you assess somebody with belly pain? Well, it's interesting. You notice my list doesn't have CT scan at the top. I'm old school, I'm an old guy. Serial exams. Look at the kid, go in a little bit and look at him a little bit later. And go in and look at him a little bit later. Serial exams. How much do we charge for that? Pretty cost effective. How good are your clinical skills? Actually, honestly, the more exams you do, the better you'll get. Okay? We haven't gotten to the point in medicine yet where we never have to lay a hand on a patient. Labs, complete blood count is very helpful. If you have an elevated white count, that tells you something. If you're anemic, that tells you something. A urinalysis can be very helpful. The urinary tract often mimics as a GI problem. That's because the kidneys want to be part of the GI tract. Pregnancy test, okay? And, again, I have teenage daughters. That's always a big scare, Chest x-ray. I can't tell you how many times I've seen a kid and they have belly pain. They have a cough too, and you check and they have like a lower lobe pneumonia, okay? A lot of things referred. Our nervous system is very funny, and a lot of things get referred to a lot of funny places. So if you have you have some things that lead you that direction, check a chest x-ray. Ultrasound or a CT scan, if they don't improve, although I think ERs now, they scan them before they take their insurance information. Just scan them on the way through the door. Okay. Now, you see the bottom line on the slide. If you look at the bottom line in these slides, if it sounds like an appendicitis, the answer is always surgery, not more testing. Kids rupture faster. All right? Their appendix ruptures much faster than it does in adults with appendicitis. And if it is an appendicitis, it needs to come out. All right? If it sounds like an appendicitis. Now, what I'm saying is not something that it could be. I'm saying if it sounds like an appendicitis, the answer is always surgery. All right? Always surgery. Again, if you've ever seen anybody who's had an ruptured appendix and you got peritonitis and you have those complications, you don't want to go there. And that's important to take away. All right? Now, I was mentioning the school kids earlier. Chronic recurrent abdominal pain of childhood, or functional abdominal pain. You notice the acronym is CRAP. Okay? All right? Yeah. And we're coming right into the season for that. All right? School is starting in Tennessee. In the next few months, we're going to get all these phone calls for kids that we need to see because of belly pain. They have lots of missed school. Overall, there's usually over 3 months of duration, although it might get better in the summers or Christmas break. Usually 6 to 14 years of age, apparent abdominal pain, stressors increase their symptoms, normal growth, normal exam, hemoccult negative, labs are all normal. Treatment is reassurance and education, or RED, I call it, the RED approach, okay? Reassurance, education, and dietary change. That's the answer to a lot of things, okay? I say take out, caffeine and, the spicy, greasy foods. I call it the red approach. We do that for a lot of things. The red approach works for a lot of things. All right. What are the red flags? What are the flags, that make you think there's something organic going on in belly pain? Well, these kids have terrible pain, can't go to school, but they sleep. In fact, they sleep 10, 12 hours. That tells you something. But if they awaken with pain, now that's a little different story. The pain is in a funny location. They lose weight or they fail to thrive. They have fevers. They have a rash. It's hard to fake a rash. Joint pain, ulcers on their mucous membranes. There is blood in the stool. Now, I'm not talking about a stool that they pass and send to the lab, because that a lot of times is anal. Okay? I'm talking about a sample from within the vault. All right? If you're going to test it, do it right. Put on the glove, get the lubricating jelly, get a Hemoccult card. That's the right way to do it. Anemia, elevated sed rate, and a family history. You can't throw family history out. There's a family history of documented ulcer or a family history of inflammatory bowel diseases. You can pick your friends, but God picks your parents. All right?